canine patient prep begins after induction and intubation are complete. As anesthetics decrease tear production, which can cause the corneas to become dry and prone to ulceration, first lubricate the eyes. Olive or corn oils can be used as inexpensive and safe lubricants and can be kept in small dispensing bottles. Always be certain that the patient's eyes do not come in contact with the tip of the bottle, which will ensure it is kept clean, thereby preventing the spread of any disease. Next, gently roll the dog onto his or her side with the feet facing toward you and insert the positioning or V-tray at the patient's back. The cranial edge of the V-tray should line up with the point of the dog's shoulder. Then, slide both arms underneath them, grasp the V-tray, and gently pull it toward you to complete the roll of the patient onto his or her back. At this point, turn on the appropriate level of oxygen and isoflurane. Connect the patient's endotracheal tube to the F circuit and check the patient's cuff for an appropriate pressure seal. Place the pulse oximeter probe on the tongue, which is the preferred monitoring site in dogs. Next, check the patient's parameters, including obtaining a manual heart rate and observing respiratory rate and character. While performing these checks and adjusting isoflurane accordingly, begin the surgical prep. Inspect the clippers for broken teeth or overheating, and when deemed satisfactory, proceed with shaving the patient. For a dog spay, shave from the cranial margin, which is the xiphoid process, all the way to the caudal margin, which is the brim of the pubis, and 1 to 2 inches laterally on each side of the mammary chain. The surgical margins for a dog neuter depend upon the method of approach. A prescrotal approach entails shaving from the tip of the penis to the cranial edge of the scrotum and then 2 inches laterally on either side of the penis. A scrotal approach involves shaving a large square or box around the scrotum, including the scrotum itself. The box should extend 2 to 3 inches out from the scrotum on all sides. Extreme care must be taken while shaving the scrotum itself, as it is very delicate tissue. As such, a small amount of remaining hair on the scrotum is preferable to cutting the skin or causing clipper burn. The initial shave should follow the grain of the hair. Manipulate the direction of the clippers as needed, keeping the clippers flat against the skin to avoid snagging or cutting it. During this time, continue to monitor the patient closely for appropriate depth of anesthesia. The final shave then goes against the grain, which helps remove as much hair as possible. After the shave is complete, vacuum all excess hair from the patient and blanket. If the patient is female, you will now express her bladder, which helps keep the urinary system more safely out of the way during surgery. To do this, she must be under an appropriate plane of anesthesia. If the patient is too light under anesthesia, there will be a significant amount of resistance upon attempts at bladder expression. These patients should be allowed more time under anesthesia to reach a surgical plane. If it is determined that she is adequately anesthetized, locate her bladder, which will generally be located around the midline and in the caudal half of the abdomen. It will feel similar to a balloon. Once identified, isolate it with 1 or 2 hands and attempt to squeeze in a caudal motion. It may be helpful to try to pick it up or move it slightly caudally. 1 hand is usually adequate in small dogs or puppies, though 2 hands may be necessary in larger dogs. Oftentimes, a winking of the vulva may be noticed just prior to the release of urine. Continue applying moderate pressure until the bladder decreases in size or the flow of urine stops. For male dogs, intratesticular blocks are now administered to provide additional analgesia. Obtain the appropriate amount of lidocaine for the size of the dog and place a 25-gauge needle on the syringe. Following the initial scrub on the scrotum, half of the dose is injected slowly into the side of each testicle, waiting a minimum of 3 seconds before withdrawing the needle. When prepping a Crypt Orchid canine patient, shave using the same surgical margins used for a dog spay. Express the bladder of the male patient to help the urinary system locate itself more against the dog's dorsum, so it is out of the way during surgery. Once the bladder is expressed, flush the prepuce with warm chlorhexidine solution. If the patient has one descended testicle, draw half of the intratesticular block dose and administer to the descended testicle following the initial scrub. The surgical area must be clean prior to the final sterile applications of the surgical scrub and solution. Use warm chlorhexidine scrub gauze and very gently wash the area, then wipe clean with the solution gauze. At this point, if the patient appears clean, make one swipe in the area of the incision with chlorhexidine scrub gauze and check for discoloration. If the gauze is still discolored or dirty, continue cleaning with the same scrub and solution until the test gauze comes clean, at which point the sterile surgical scrub may begin. To do this, place 2 piles of gauze across the palm of one hand. One pile will be 4 gauze squares soaked in chlorhexidine solution, and the other pile will be 5 gauze squares soaked in chlorhexidine scrub. Take 1 scrub gauze and start at the top of the incision area. Move the gauze straight down midline and then into a circular motion without passing over the same area twice, going from inner to outer edge. Follow with solution and repeat the process 3 more times. When finished, 3 pieces of gauze remain, 1 scrub and 2 solution. Fold the last piece of solution-soaked gauze in half and place over the incision area for contact time. Avoid touching the side of the gauze that will be in contact with the patient's skin. At this point, prepare to move the patient into surgery. First, make sure an appropriately sized bag and F-circuit are on the anesthesia machine. If the dog was prepped on a blanket and it has remained clean and dry, it may travel with her into surgery. If it is wet or soiled, place a clean blanket over the V-tray on the surgery table. Back at your prep station, disconnect the endotracheal tube from the F-circuit, turn off the oxygen flow meter and isoflurane, and cap the F-circuit with a bag. Remove the pulse oximeter from the patient's tongue and clip the probe onto a disinfectant pad that is safe for contact with live tissue. Pick up the dog while supporting the head and neck and carry her carefully to avoid contamination of the surgical site. This is best accomplished by tucking the patient's head in the crook of one arm and holding her front paws with the hand of that arm. The other arm will go underneath her back or hips. Always use 2 people if the dog is large, usually 35 pounds or more. Once you have placed the dog in the new V-tray and dorsal recumbency, adjust the oxygen and isoflurane and connect the patient's endotracheal tube to the F-circuit. Connect the pulse oximeter probe to the tongue. Now check the patient's parameters, including obtaining a manual heart rate and observing the character and rate of respiration. Place the patient's baggie next to her, along with ink and glue. Finally, when the doctor is ready, open the surgical pack using aseptic technique and remove the solution gauze from the incision area. Continue to monitor the patient and remain aware of the surgical process in order to be of assistance.